Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Let me introduce myself. My name is Ratna Wijayatri. I'm from Muhammadiyah Magelang University. In this session, I want to explain about the implication of combination between virgin coconut oil and plasma jet for acute wound healing. There is our research background. There are many things here. VCO plasma jet for in combination for wound healing. VCO is a natural oil rich in vitamin and antiviral activities. VCO was found to be better than silver sulfadiazide cream in healing of diabetic wound via promoting reepithelialization and collagen synthesis. This is an article from Saliman et al. 2018. And then from Marina et al. VCO also has phenolic content and higher antioxidant activity than deodorized coconut oil. We know wounds are even that damage the structure and normal epithelial tissue occur in the skin, muscle, nerves, and blood vessel caused by various factors, both internal and external factors that affect of injured tissue. Wounds are physically injuries to one of the tissue in the body that results in a break in the continuity of the soft part of the body structure. Wound healing is a normal biological response to a natural occurring injury as long as local treatment is adequate. The normal phase of wound healing, namely reaction, regeneration, and renovation, takes place without difficulty. If the wound care is not carried out properly, it will cause infection of the wound by bacteria, Staphylococcus aureus, Pseudomonas aeruginosa, E. coli, Streptococcus pyogenes, and etc. Plasma jet, we use that combined with our VCO. Plasma jet produce reactive oxygen specimen or ROS, which at certain concentration, non-toxic, will help in wound healing. And then plasma jet can accelerate wound healing by inducing cell proliferation, formation epidermal layer, and migration of keratinocytes. According to the research conducted by Tirumdas, combined plasma jet with liquid phase compound have different composition from water and can be alternated by method for microbial disinfection. There is our method of the research. The natural product used is a VCO and then plasma jet. They were treated by atmospheric plasma jet with distance 20 millimeter during 3 minutes before and after. And then we can get some result. Bulb C mice, we use that, the species of bulb C mice, male, age 7 to 8 weeks, divided into 6 groups. This is our trial protocol from 0 day until 40 days for all groups. We can see that step by step that we treat in the mice and use 6 groups: group of dressing, VCO, plasma activated VCO, and then plasma VCO here. We can know 0 day is the day of the wound was made here, and then first day is the day that wound was observed. Acute circular wound making. Acute circular wound were made using punch biopsy with diameter 4 millimeter. The mice were anesthetized before the wound was made. Anesthesia was performed a mixture of ketamine at dose 50 milligram per kilogram body weight and siloxane at a dose 5 milligram kilogram body weight, administered intraperitoneally. Before observation, the environment surrounding the wound was cleaned with saline solution, and then we use digital camera to visual documentation every observed wound. Lumic Panasonic, with the mark Lumic Panasonic, and then we can see the image. This is a wound that we make to our mice. The ratio of the area of the wound was obtained by comparing the area of the wound of the right and left dorsal. The area of the wound is calculated by the formula wound area of day per wound area of 0th day. This is our research result. In this image, we can see ratio of the area of the wound by all of the group. And then this is the image of the macroscopic visual observation of wound a day on 0, 3, 7, 11 until 14th day. This is our description. Or for oxaverin, D for dressing, P for plasma, V for VCO, and then VP for VCO plasma, and then PV for plasma VCO. There is different thing that in the VP group we give VCO before plasma, and then in the PV group we give plasma before VCO and the one on mice. During the research, no one direct use in the study died before the research process end, and there were no observed adverse effect in the animal use in this study. The measurement of wound length on day 0 to 14. On 0 day, the wound entered inflammatory phase, which was marked by an enlarged wound size, exuded appearing, and gradually entered proliferation phase, which was characterized by the size of wound, until 14 day, which was the end of the observation period. We can see at the graph ratio of the wound area in the 4th day, all of the group except VP group experience of the peak inflammation. We can see that in the 4th day, all of the group except VP. In the VP group, the peak of inflammation occurred earlier on 3rd day, but has long proliferation phase. This may be due to the interaction between ROS and antioxidant compound in VCO, cause a decrease of ROS produced by plasma. This is the same of the research by Dewi 2021, which examines the combination of plasma and binalhong leaves with a close time course the absorption of ROS demonstrated by absorption test in UV light. From figure, it can be seen that all groups have the same pattern of wound healing when entering the inflammatory phase in 0th day until 5th day. There was increase in the wound ratio and then entered the proliferation phase, which was marked by gradual decrease in the wound ratio. On the 4th day, the day V and VP groups had the same wounds area ratio. The high peak of inflammation, day 4, 4th day, in group oxaverin was due to excessive exudate production, so that the wound dressing media was unable to absorb the entire exudate. We can see the image. Yeah. As a result of excessive exudate production, make the wound wet. So it increased the size of the wound. We can see the image before that the ratio of the wound is more large than the others. Exudate serve to maintain an optimal wound here for environment, but at high concentration, it will increase the happen on infection. The wound cause damage to the blood vessel, causing the cell around the wound to become hypoxic. In the earlier stage of hypoxia in the wound, it will stimulate tissue repair and angiogenesis and stimulate the synthesis of cell growth. But this process only lasts for 48 hours. Then the pressure around the wound will experience hypoxia, which will inhibit the process of collagen synthesis by fibroblasts, thus slowing the wound healing process. Giving oxyverin will stimulate the phagocytosis process and increase oxygen tension in the wound and can activate myofibroblasts for wound contraction so that it can accelerate wound healing. When compared to all groups, the group presenting VCO alone had a relatively faster but longer inflammatory phase when compared to the others. In terms of wound healing, this group had a relatively faster proliferation phase and experienced a faster reduction in wound area and results in wound with a small wound area ratio. And Silalahi research in 2015, it was stated the topically VCO serve as a moisturizer that provides an optimal environment for wound healing. VCO contains phytosterol or plant steroids potent to reduce inflammation that stop to bleeding and prevent widespread burn. VCO contain from Silalahi 2. There is VCO contain medium chain fatty acid, especially lauric acid, medium chain fatty acid, or MTF are unique properties that easily absorbs into the cell and increase metabolism. In addition to increasing metabolism, cell will work more efficiently to work a new cell and replace damaged cell that will accelerate the healing of the wound. The investigation showed the wound size percentage in group containing VCO-activated plasma jet, which one is given plasma jet treatment first with distance 20 millimeters during 3 minutes, which had almost closed completely on the 14th day. Yes, we can see that in this picture. Yeah. This is smallest area of wound in treatment PV plasma before VCO. VCO, we know VCO can be produced from fresh coconut or coconut milk, which is rich in medium chain triglycerides and lauric acid. Lauric acid is a precursor of monolaurin, which can modulate immune cell proliferation. If a wound occurs, the inflammation process comes in and immune cell activity increases. Yeah, this is our conclusion. The results showed that plasma activated virgin coconut oil group has the smallest size wound healing activity. Plasma jet may better support virgin coconut oil for acute wound healing. Okay, thank you for your attention. I'm so sorry if there are many mistakes here. Wassalamualaikum warahmatullahi wabarakatuh.